So, good afternoon. We are talking about pharmacokinetics today. So, we'll talk about drug absorption, bioavailability, the distribution of the drug, metabolism, and then we'll look at drug excretion. So for drug metabolism, we'll look at it in another lecture. I didn't want to overload you with too much. Then we'll look at drug excretion and elimination, and then the enzyme reactions in the next class. Okay. So if we talk about the standard dose of a drug, it is based on trials in healthy volunteers to determine how much to give based on the average ability of the person to absorb, to distribute the drug, and then to eliminate the drug. Give me a minute, my battery is low. So the dosage will not be suitable for every patient because there are several physiologic processes that determine the dosage. For example, maturation of organ function in infants. So if you take a drug like paracetamol, which depends on the liver for excretion, because the liver is not well matured in neonates, we hardly give them paracetamol. Then sometimes there are certain pathologic processes that can affect the drug dosage and require dosage adjustment. For example, an individual with heart failure or renal failure. So these processes would modify the specific pharmacokinetic parameters. So when we talk about pharmacokinetics, two processes are key. We have the clearance, which is the measure of the ability of the body to eliminate the medication. Then we have volume of distribution, which is the measure of the apparent space in the body available to contain the drug. What this means is that the clearance is looking at the ability of the body to eliminate the drug. And the volume of distribution drug, basically. So let's look at the volume of distribution closely. Volume of distribution relates to the amount of the drug in the body. It relates the amount of the drug to the concentration in the blood or the plasma. So volume of distribution may be defined with respect to the blood, the plasma, or water. What this means is that you're looking at how much of the drug is available in the blood, how much is available in plasma, and how much is available to water. The volume of distribution can exceed any physical volume in the body because it is the volume necessary to contain the amount of blood at the concentration found in blood, plasma, or water. So if you have a drug with a high volume of distribution, what does it mean? It means that it has a higher concentration in the extravascular tissue compared to the vascular compartment. Then you can have some medications which are completely within the vascular compartment and not in the intravascular compartment. So for such medications, you say the volume of distribution equals to the amount of drug present in just the intravascular compartment. So if you take a 70-kilogram man, for example, you know that 2.8 liters of that person is plasma. So the volume of distribution is the amount of drug that is in the 2.8 liters of this patient's plasma. So let's look at drug clearance. Drug clearance is the factor that predicts the rate of elimination in relation to the concentration of the drug. So it is defined with respect to blood, plasma, or unbound in water. So this looks at how much of the drug is able to be cleared from the circulation per unit time. and the clearance is additive. So if you take maybe clearance from, and the clearance or the elimination of the drug is from various organs. So the kidney, the lungs, the liver, maybe the GI are all involved in clearing the drug. So it is additive, meaning that if you want the total clearance of the drug, you're looking at the clearance from the kidney, the clearance from the lung, the clearance from the liver, and other organs together. And this equals the total systemic clearance of the drug. The two major sites of drug elimination are the liver and the kidneys. If the drug is cleared unchanged in the urine, that is renal clearance. When you take the liver, there are two things that can happen. Either the drug undergoes biotransformation to one or more metabolites, or it is excreted unchanged into the bile, or both can happen. So you can have a drug which is excreted in the bile. Some of it is also changed, and in this case, both processes are occurring with the same drug. For most drugs, the clearance is constant over the concentration range encountered in clinical settings. So, it means that if you take the medication, the amount of the drug that is cleared will remain the same. And this is known as a first order elimination. And if you have a graph of the time plotted against the concentration of the medication, then the area under the curve is the clearance. So there are two types of clearance. We have capacity limited elimination, in which the clearance depends on the concentration of drug that is achieved. So for example, phenytoin or ethanol, that's alcohol. In this case, it is a non-linear graph. And most of the drug will become saturated if the dose is high enough. So if the dose exceeds the elimination capacity, then the steady state cannot be achieved. What this means is that if the dose is higher than the ability of the body to clear the medication, then you never have a steady state. So the concentration of the medication will keep on rising as long as you keep dosing the medication. So this pattern of capacity limited elimination is important for three medications: ethanol, phenytoin, and aspirin. And these medications, the clearance has no real meaning because the clearance depends on how much of the medication is being taken. So since the medication is being taken constantly, the clearance is like there's no steady state achieved. Okay. So apart from the capacity limited elimination, there's also the flow dependent elimination. This has to do with how readily the blood flows to the organ of elimination occurs. So at any clinically realistic concentration of the drug, most of the drug in the blood perfusing the organ is eliminated on the first pass of the drug through it. What this means is that once the medication passes through the organ, so the elimination of the drug depends on how much of the drug is brought to the organ of elimination. So this means that in organs where the blood flow is slowed down, then the rate of elimination will also be slow. So such drugs are called high extraction drugs because they are almost completely extracted from the blood by the organ. It's as if the organ is like a sponge. So as soon as the blood passes through that particular organ with the medication involved, it is almost completely extracted by the medication. So blood flow to that particular organ is the main determinant of drug delivery. But how much of the drug is bound to proteins in the blood also determines how much of the medication is lost. Then we'll look at half-life. So half-life is a time required to change the amount of drug in the body by half during elimination. So if you give a medication and then within 2 hours, half of it has been eliminated and is left with half in the blood, that is the half-life. So the 2 hours will become the half-life of the medication. In the simplest case, the most useful drug dosage depends on a single compartment of the body as a volume of distribution. So you have the drug available in the blood circulation, and the amount of time required to clear half of this medication is the half-life. So the time course of the drug, how long the drug will spend in the body, depends on the volume of distribution. That is how much volume is available for distribution of the blood, as well as the clearance. So disease states can affect the volume of distribution and the clearance, but a change in the half-life will not necessarily reflect a change in the drug elimination. What this means is that if there's a problem with the kidney, for example, the half-life of the medication is the same, but the problem in the kidney will affect the clearance or how quickly the medication will be cleared from the system. In this case, you may need to increase the dosing of the medication so that it will not become toxic, because the kidney has a problem, so it's not able to clear the medication as quickly as it should. So, for example, patients with chronic renal failure have decreased renal clearance of the drug digoxin, and they also have a decreased volume of distribution. We also have another concept called accumulation. So whenever the drug doses are repeated, the drug will accumulate in the body until the dosing stops. This is because it takes time to eliminate all of a given dose. So if you take a medication, it takes time before the body will completely clear the whole medication. If you keep on taking that medication, then the drug will accumulate in the body. Basically, that's what it means. So in practical terms, this means that if the dosing interval is shorter than 4 half-lives, accumulation will be detectable. The accumulation, there's something called the accumulation factor. This is equal to, is inversely proportional to 1 minus the amount of drug that is left. So this is the equation, how you express it. So accumulation factor is equal to 1 over the fraction lost in one dosing interval. And so it's inversely proportional to the half-life, because the fraction lost in one dosing interval is the half-life. Then we have bioavailability. So we say, for example, that the amount of iron in breast milk is low compared to the amount of iron in formula. However, the iron available in breast milk is highly bioavailable. So what does bioavailability mean? Bioavailability is defined as a fraction of the unchanged drug reaching the systemic circulation following administration by any route. So in simple terms, what this means is that if you give a medication, how much of the medication ends up in the systemic circulation after you administer it by any route. So if you have a concentration over time curve, the area under the curve is a measure of the extent of bioavailability. So to explain this further, if you give a medication by the intravenous route, that medication has a bioavailability of 1, because bioavailability is looking at how much of the medication is available in the blood circulation when you give it by any route. And so if you give it by intravenous route, all the medication is available, so the fraction is 1. However, if you give it orally, the bioavailability may be less than 100% because of 2 reasons. 1, incomplete extent of absorption. So if you give the medication orally, the medication will have to be absorbed from the gastrointestinal tract, and that absorption is not 100%. So the bioavailability of the medication will be less than 1. Then there's also what we call first pass elimination. That is elimination of parts of the medication before it gets to the systemic circulation. So we'll try and look at the extent of absorption. So after oral administration, a drug may be incompletely absorbed. For example, if you take the medication digoxin, only 70% of a dose will reach the systemic circulation after oral administration. This is mainly because there's a lack of absorption from the gut. Other drugs may either be too hydrophilic. So an example is atenolol, or too lipophilic. Example is acyclovir, to be absorbed easily. So hydrophilic means that it is soluble in water, or it is water loving. And then lipophilic means it is soluble in lipid, or the fat layer of the cell membrane. These two can decrease the bioavailability. So let's explain it further. If a medication is hydrophilic, it means that it dissolves more readily in water. And so in the gut, the medication is well dissolved, but it cannot cross the lipid cell membrane into the systemic circulation. So that will limit the extent of absorption of the drug. If a medication is too lipophilic, it means that it is soluble in the plasma cell membrane, but it cannot cross the water layer adjacent to the cell to get into the systemic circulation. Also, sometimes you may have a reverse transporter in the gut known as a P-glycoprotein. So the P-glycoprotein actively pumps drug out of the gut wall cells back into the gut lumen. So if you have anything that inhibits this P-glycoprotein, then you will be able to increase drug absorption. So for example, grape juice has been found to be associated with substantially increased drug absorption because it inhibits the P-glycoprotein and gut wall metabolism. So let's try and understand what the first pass elimination is. So just to recap, I was saying that the medication is not 100% bioavailable if you take it orally, because when you take it orally, its presence in the systemic circulation depends on the absorption through the gut, and then also first pass elimination. So we looked at the absorption through the gut. We've understood what lipophilic and hydrophilic means. So now we are going to look at what first pass elimination means. Okay, so following absorption across the gut wall, so the medication has now been absorbed across the gut wall, and it's in the systemic circulation, it's in the blood. But that blood is the blood in the portal vein. If you remember your anatomy, after digestion, blood goes to the portal vein and then goes to the liver. Then from the liver, the body determines what should go into the systemic circulation. So when the absorption has passed through the gut wall and the medication is in the portal blood, this portal blood will now deliver the drug to the liver prior to entry into the systemic circulation. So the liver is like a second gate. So the first gate is the gut. Then the second gate is the portal circulation, that is the liver. So a drug can be metabolized in the gut wall. So most commonly, it is the liver that is responsible for metabolism before the drug reaches systemic circulation. In addition, the liver can also excrete the drug into the bile. So any of these sites can contribute to a reduction in bioavailability of the medication. So the overall process by which the medication is decreased from the gut to the systemic circulation is known as first pass elimination. So the effect of the first pass hepatic elimination on bioavailability is expressed as the extraction ratio. That is the amount of the drug that is extracted from the portal circulation before it is sent into the systemic circulation. In order for us to really understand this, you have to go over your GIT, the absorption, the hepatic circulation, the portal vein, and all that, so that you really understand what I'm talking about. So let me give an example. So a drug such as morphine is completely absorbed, and so the loss in the gut is negligible. However, when it gets to the liver extracts some of the morphine. So the hepatic extraction ratio for morphine is about 0.67. And so their bioavailability is 1 minus this fraction. And that makes the bioavailability of morphine to be about 33%. Okay. So the rate of absorption of the medication is determined by two things: the site of administration of the drug and then the drug formulation. So the rate of absorption and the extent of inputs can influence the clinical effectiveness of the medication. So differences in rate of availability may become important for drugs given as a single dose, such as a hypnotic used to induce sleep. The mechanism of the drug absorption is said to be zero order when the rate is independent of the amount of drug remaining in the gut. For example, if you give a medication and it is independent of the rate of gastric emptying. However, if the full dose is dissolved in the gastrointestinal fluids, then the rate of absorption is usually proportional to the gastrointestinal concentration, and this is first order. So extraction ratio and first pass effect. So what extraction ratio means is the amount of the medication that is taken up from the portal venous circulation by the liver before it is made available to the systemic circulation. So because of this first pass elimination effect, when you are given an oral medication, you have to give larger doses than intravenous medication. So in this case, the amount of the drug metabolites will also be higher. If you are giving, let's say, 1 gram of a medication, IV, if you are giving the same medication orally, you have to give more, because when you give it more, you compensate for what will be lost in the gut and what will be lost by first pass elimination in the liver. And so you can do this, but then you should also bear in mind that if you give higher doses of the medication, you are increasing the concentration of the drug metabolite, which might be toxic. So let me give an example. There are two medications, Lidocaine and Verapamil. They are both used to treat cardiac arrhythmias. That is abnormal rhythm of the heart, or when the patient has palpitations. And both of them have a bioavailability less than 40%. However, you don't give lidocaine orally because the lidocaine has metabolites which will contribute to the toxicity of the medication. Other medications that are extracted by the liver when it is given orally include morphine. So we just looked at morphine and we said the extraction ratio is 0.67. And so the bioavailability, or the amount of morphine that's available to systemic circulation, is 0.33. Verapamil is also extracted by the liver, and then certain tricyclic antidepressants, for example, amphetamine, is extracted by the liver, as well as isoniazid. So drugs with a high excretion ratio will show marked variation in individual patients depending on their hepatic function. So what I mean to say is that if the medication is extracted by the liver and there's a problem with the liver, then if let's say Mr. A has a liver problem, but Mr. B doesn't have a liver problem, the dosage of the medication that is given in the person with the liver problem would vary compared to the one who doesn't have a liver problem. To explain further, the one who has a liver problem will not be able to extract the medication, and so the dosage will have to be adjusted, because if the person is not extracting some of the medication from the blood before it becomes available in systemic circulation, it means that if you give the two of them the same dosage, the one with the liver problem will have a higher dosage of the medication or a higher proportion of the medication in their systemic circulation because their liver is not working well. And so this brings to fore the dosage adjustments. Please excuse me. Hello, Prince. Yeah, Tete. Good afternoon. Yeah, come no mashishika. Inde ko wa nyo chonshi anu ba hibi ane lo. Alo wo. Mebo baba. Yeah, sure. You will call back. Call back no trouble bell over here. All right, so you are doing. Hey, we are running out of time. Ha. Okay, I think we are almost done. Okay, so yeah. So drugs that are poorly excreted by the liver include chlorpropamide, diazepam, phenytoin, theophylline, tobutamide, and warfarin. There are several more examples. Okay. Oh, sorry. So to circumvent this first pass elimination by the liver, we use alternative routes of administration. So there are several reasons for different routes of administration. Sometimes we give oral medications for convenience, but when you give it for convenience, you have to be mindful of the first pass elimination and adjust the dosage appropriately. Sometimes too, you want to maximize the concentration at the site of action and minimize the concentration elsewhere. So you might give the medication topically. So let's say a child has a rash and it is a bacterial infection. So because you want to maximize how much of the antibacterial you are giving at that site of the rash, you give it topically. Or let's say an eye infection, topical application, whereby it goes to exactly where you have the problem. Then sometimes you also want to prolong the duration of drug absorption. So you can give it transdermally as a patch, which is attached to the skin, and then it's slowly released into the systemic circulation. Sometimes you might want to avoid the first pass effect, which we just talked about. And so you give the medication by the intravenous route. The hepatic first pass effects can be avoided to a great extent by use of sublingual tablets and transdermal patches, and to a lesser extent by the use of rectal suppositories. So if you want to avoid the medication going through the liver and some of it being reduced, you can put the medication under the tongue. There's a rich supply of blood vessels under the tongue. So when you put it sublingually, it goes straight into the systemic circulation. Transdermal patch also has the same effect. And then rectal suppository. Now, the problem with the rectal suppository is that the blood vessels around the lower rectum, some of these vessels would enter into the liver, the portal circulation. Some too would go into the inferior vena cava straight, bypassing the liver. So when you give a dose rectally, only about 50% of it will bypass the liver. The rest will go through straight into the systemic circulation. If you take inhalation routes, the inhalation route also goes through first pass elimination because there's loss or excretion of the medication through the, like the way the liver does with the first pass metabolism. Okay, so this is where we'll end. If there are any questions, if in the midst of the questions there it stops, you can rejoin with the same details. This is a recurring meeting. Are there any questions? How many people? 23 participants. Please ask your questions.
Madam.
I can't hear.
Hello.
The volume is very low.
Madam.
Please, how different is first pass elimination?
Please hold on.
To
Sorry.
first pass?
Sorry. Please give me a minute. I'm coming. Kevin. Yes. The guy who brought the water, yes. I wanted to give you the money. Hold on. Where's my bag? Thank you. Okay. And kindly close my door for me. Yes, please ask your question. Sorry.
Yeah. So I was asking for you to help differentiate first pass elimination and first pass effect.
And first pass
Elimination and effect.
So the first pass elimination is what occurs in the liver when you so when you take the medication orally, for example, it is absorbed in the liver. Oh, what's happening? Okay. So you take the medication, it's absorbed in the liver, and it's absorbed in the gut, sorry, and it goes to the portal vein. From the portal vein, it goes to the liver. When it comes to the liver will eliminate some of the medication, and that is what we call the first pass elimination. The first pass effect. It's the same thing. It's the same thing. The first pass effect has to do with the effect of that elimination on the bioavailability of the medication. Are you okay? Who asked the question?
Yeah, doc.
Sorry, I was a bit distracted. Okay, so what I'm saying is that the first pass elimination is the liver extracting some of the medication and clearing it or eliminating it when the medication comes to it from the portal vein. The first pass effect is this phenomenon which occurs, leading to a decreased dosage of the medication when you give it by the oral route compared to the IV route. Are you okay?
Oh, okay.
So the elimination is the liver clearing it. The effect is that process which informs your change in dosage when you're giving it IV compared to when you're giving it orally.
Okay, thank you.
All right. Any more questions?
Madam.
Yes, please.
Yeah, you talked about the oral, the IV, and so what about the one that the ladies insect? Does it go through the first?
Insect where? Vaginally.
Is
Is it a vaginal pastry?
Yes, please.
Does it go through what?
The first pass effect or that one?
No. So when you give a vaginal pastry, it goes through the blood circulation streets because you have a network of blood vessels around there. It's similar to the rectal route.
Oh, okay.
Yeah. Any more?
Madam.
Yes.
Madam, good afternoon.
Good afternoon.
Madam, please, this is Benson.
Hi, Benson.
Madam, my own is a nice question. Madam, how are you and the family?
Interesting. We are fine.
It's been a while. I'm missing you.
Hey.
Interesting.
Weren't you in class yesterday?
Oh, yesterday, but I didn't come for class. That's why.
Ah, okay. All right. So go ahead with your question.
Madam, the question is, how are you and the family? That's the question.
Hey. Okay. Okay, we are fine. Thank
I
you.
care about you. It's very important.
Yes. Yeah. Any more
Hello,
questions?
Doc.
We have less than 1 minute. Yes.
Hello, Doc. I wanted to find out that does that mean that apart from what you said, that means most drugs they go through the liver for the bioavailability.
Yes. Once you take it orally.
Okay.
Yes. Yeah.
Okay. Thank you.
All right. So are we done?
I think yes. Yeah.
All right. So I'll try and send the notes to you this evening. I want to sort out a few things in the house. By 6 o'clock, I'll be ready to start sending the lecture notes out. So expect them.
All right, Doc.
Yes, Doctor.
Doctor, today when you are preparing something, remember us. We are hungry too much. Okay.
Okay.